Hello, everyone. Welcome to This Day. Today is Wednesday, and it is May 6th, but it is also National Nurses Day, and how fitting for what we're going through today. And I'll give you just a little background there. National Nurses Week begins today and ends on May 12th. Now, this is the birthday, May 12th is the birthday of Florence Nightingale. And Florence Nightingale was a celebrated English social reformer, statistician, and the founder of modern nursing. She became well known while taking care of the wounded soldiers during the Crimean War. Nightingale was dubbed the Lady with the Lamp because of her habit of making rounds at night. So there's a picture of her visiting a soldier. So in any case, we want to thank you to all of our nurses today and every day that you are working on the front lines to help us battle the coronavirus and COVID-19. All right, on our show today, we are going to bring you a Zoom segment with RadNet. They are open and they can take appointments, so you do not have to be afraid to get your images done. So we'll talk a little bit about that. And then I will also have some grocery information for you on how you can keep your groceries fresh and lasting longer. All right, let's go ahead and remind you of our regular resources. You can go to cdc.gov, and that is staying safe with COVID-19, as well as staying safe and not getting the coronavirus. Then you could go to ochealthinfo.com, and that will give you all the numbers per city of those that are being hospitalized, those are in ICU, and that'll give you a breakdown by city. And then you could go to the usa.gov/coronavirus, and that'll help you understand how the governor plans to reopen California. You could also go to LagunaWoodsVillageAlerts.com, where we have all of our information for local stuff. You could email us at info@LagunaWoodsVillage.com, or you could go to our recorded hotline, which is 949-268-2019. Now let's take a look at our weather. It is going to be very warm. We are looking at some very high temperatures today and tomorrow, and then we're going to cool back down on Friday. So here we can take a look. 89.63 is today, Thursday 93.60, then Friday is 81.60. Saturday will be pleasant, 80.61, and Sunday a little nicer, 77.58. So looking pretty good as we get into the weekend. Let's take a look at our sunrise and sunset. Our sunrise this morning was 5:57, and our sunset was 7:38. And this beautiful photo of Crystal Cove was sent to us by Joel Goldstein. Thank you so much, Joel. And of course, if you have a beautiful photo that you would like to share with our community, please email it to lagunawoodsvillagetv@gmail.com. All right, well, stay tuned. We'll be right back with RadNet.
Hello. RadNet is the nation's largest outpatient medical imaging network, providing thousands of imaging procedures each day. During this time, RadNet remains committed to serving the needs of our communities. Our radiology centers are open and will remain open to treat patients. Rest assured that RadNet is following CDC protocols and taking every measure to ensure the safety and well-being of our patients and staff. RadNet has recently been asked by local hospitals to help provide outpatient imaging services for their patients, and RadNet is committed to supporting those needs. We are available to take your calls and schedule your appointments. To schedule an appointment online, visit myradiologyconnectportal.com or visit our website at radnet.com for more information and to find a location near you. Be healthy and be safe.
Welcome back. Well, today I am joined by Karen Morad, who is with RadNet. And, Karen, thank you so much for being with us. I really appreciate it. Did I pronounce your name correctly?
You did.
Oh,
Yes,
thank
you
goodness.
did.
Thank goodness. Well, gosh, what's going on? How are you doing?
You know what? We're doing well. Hello, Laguna Woods. We miss you guys. We haven't seen you in a while. So a lot's been happening in the world, and we're really thankful for you guys having us on your show. So
Well, thanks
thank
for
you,
joining
Lisa.
us. And I know things have changed quite a bit, and then we are starting to reopen some things now. But there's a lot of things that go into reopening these days because we have to sanitize and do all this stuff. But before we go into some of the things that you guys have been doing, talk to me a little bit about what essential imaging is and why it's important for us to do it.
So essential imaging is as it sounds. I mean, it's an integral and an important part of a person's healthcare. We consider ourselves frontline. What that means is that just because there's this pandemic, and I'm not lessening it in any way, shape, or form, but the reality is that a person's health is absolutely mandatory and necessary. People need to come in. People need to have their CT scans done, their MRIs, their screening mammograms, their ultrasounds, their PET scans. They should not delay anything that's needed for patient care.
Right. And I know that a lot of people have really been taking a back step to some of those essential things because they're frightened out of their mind, thinking that if they go to these places, they're going to catch COVID-19. And you're not the first person that we've talked to regarding this, because there's other doctors and hospitals who are like, well, nobody's coming in for heart attacks. They're not coming in for all these other things. So what then, and then also yearly exams too, have a lot of those fallen off?
Actually, yes, they have, Lisa. A lot of women are hearing from different organizations or social media or whatever the case may be that, oh, we should wait. We shouldn't have our screening mammogram done. We shouldn't have that breast MRI that we were asked to go back for in 6 months. And unfortunately, we're finding that while people are waiting, some of these cancers are being detected, and some of them even more aggressive. So that's the flip side of things. So we don't want those numbers to increase. We want to, our whole system should be around early detection, coming in, early diagnosis, taking care of your health, taking charge of your health. And we don't want a cancer to be put off and then they're in a worse situation than they started with.
Right, exactly.
And so that's what we're finding. On the flip side, we do want people to know that we are taking strict measures, including following CDC protocols. And that involves sanitizing, cleaning, disinfecting between every patient, before and after, cleaning highly touched areas. Our employees are wearing what they call PPE, which are the gloves, the masks, the gowns. And we ask each patient who comes in to wear a mask as well. And if they don't have one, we'll provide them with one.
Okay, well, that's good. That's really good. Have you been open this entire time or by appointment only, or how has it been working?
So I'm proud to say we have remained open, and we continue to remain open during this period of time. There's been maybe a couple centers that have changed some of their hours so that we can accommodate all volumes throughout our Orange County area. For example, for the Laguna Woods population, it's the Saddleback Valley Imaging Center that is open and providing a complete gamut of services from early in the morning till later in the evening.
Okay. Well, that's good. That's good to know. So they still can go. Can they, you said the one facility, are there other facilities opened around here as well?
There are a number of centers open. OC Diagnostics is temporarily closed at this period of time, but will reopen.
All right.
So Saddleback Valley Imaging would be the closest location. Okay. We obviously have our Santa Ana locations, our Irvine locations, Orange, throughout all of Orange County, Newport Beach, all are open.
Okay, perfect. Well, that's good to know. And so for whatever facility that they want to go to, they should just contact them and make sure that the hours are what they're looking for, right?
Exactly. Okay. And I know that you're going to post that, but our our contact information, our scheduling phone number, our site phone numbers, and even the website that they can go to if they want to schedule online.
Okay, perfect. So there's lots of resources for them. So when we talk about, outpatient imaging services and, urgent care imaging, what are we talking about? I mean, obviously what you mentioned earlier was all about detecting, early detection, early prevention, things like that. But gosh, if somebody was to find something today, what do they do?
So that's a good question. So, what is the protocol? Does a person just come in and, okay, they get a diagnosis and they say, no, I'm going to wait? Or do they, continue to contact their physician and have that dialogue? Well, from a physician's perspective, I know a lot of them are doing and offering telemedicine.
Yeah.
Some of them are offering telemedicine so they can provide virtual exams and they can keep the continuity of healthcare going, the healthcare delivery system. A patient shouldn't have to wait. A patient shouldn't have to put off a chronic illness or disease. We as an imaging center are open to do whatever we need to. So there's a diagnosis, we can help with whatever the physician needs to continue his care. Okay. So we work closely with urgent care centers, and we've actually made commitments to some of our local hospitals, including Memorial Healthcare, where we're like, we want to be there for you guys. We will continue our outpatient imaging services so that you as the hospital can focus on what's going on from an inpatient perspective.
Oh, well, and excellent. That's good to know, because, like we talked about earlier, is that people were afraid to go, but if they don't have to go to the hospital, that's probably a better situation for them at this point, and rather go to your center because you're not going to have necessarily people who have the disease or virus.
Exactly. And that's why our commitment to them is such. We have a very good relationship with Memorial. They're one of our partners. And from the very start of this whole pandemic, we have committed this and made this promise to them. One of the other things I wanted to bring up is we offer what we call a virtual waiting room. So if you schedule your appointment and you get there, there's a phone number that you would text, and you would basically say, I'm here, my paperwork's done. We say, wait in your car or wait outside, and we'll let you know when to come in. That way you retain social distancing with those around you, and you have privacy. And once we're ready for you, we take you back.
That's great. I mean, that's some of the things that I think a lot of people have to put into place. Many places did shut down and weren't fortunate enough like you to be able to stay open. So they had to reopen in a totally different manner. And maybe you might even have to make adjustments as well. Like, for instance, I know you said that you have gloves or you have the PPEs and that type of thing. Did you make any other modifications? For instance, people are talking about putting plexiglass and stuff up on the welcoming areas. Did you guys do that, or is that something you don't think is necessary?
Actually, we are in the process of doing that at our centers. Okay. So we're putting the plexiglass up. For some of the procedures that are a little more invasive, some of the interventional procedures, and even to a degree, some of the mammograms and ultrasounds, our techs are wearing the full shields, not just the face masks.
Right.
And that's for the protection of patients as well as for the employees.
Yeah.
So
go ahead.
No, I was just going to say, by offering those features with the masking, with the social distancing, with the waiting room option, so that it's called a virtual waiting room, you don't have to sit in the centers. We've also separated out chairs. So just like many airlines are planning on doing, where they're not occupying the middle chair, we're moving chairs so that there's actually a 6-foot distance between two people.
Yeah, so some of the many changes that you've had to make it work, and it's an interesting way to look at things these days. And I wonder what it's going to be like when other things start to open, because I think we're super conscientious of this now. Which I've always been kind of a germaphobe anyway, so it's nothing new. But now when we go to the restaurants and things like that, it is going to be different. So that's good that you've made it really comfortable for our community, because we do have a high risk community. And I think that's really good to know. And I'm glad that you're able to be here to tell us what you're doing and that you are open and that people do not need to be afraid.
Thank you so much. Yes, we love Laguna Woods. We've had a long relationship with you, and we want your safety as well as ours. So we're not going to do anything to jeopardize that. So
Excellent.
Rest assured, you're in good hands.
Excellent. Well, Karen, is there anything else that you'd like to add?
No, we want you guys to be healthy and safe, and we'll get through this. Together we will.
All right. Wonderful. Well, thank you so much. And we'll see you again soon.
Thank you very much for having me.
You're welcome.
Bye-bye.
And we'll be right back after this.
Under the RadNet umbrella, prostate imaging is one of our most important men's health initiatives. We have an exclusive team of prostate-dedicated radiologists that read thousands of images from all around the globe. These radiologists are utilizing advanced technologies such as prostate MRI, which offers some of the most detailed visual representations of the prostate gland. When it comes to men's health issues, listen to your body and take a proactive approach. Talk to your doctor, begin screening, and take charge of your health.
Welcome back. Well, we wanted to help you with keeping your groceries fresh longer. So we have a couple of ideas for you that we think might be helpful that we found on a really great resource. There's plenty of resources on the internet, but we just wanted to share that with you to save you the time from searching. So one of the things that you can do with your bread is you can properly wrap it and seal the bread in one of these little Ziplocs. Now you can even use one of the freezer Ziplocs and keep it in the freezer for up to 6 months. So that's kind of a nice thing. So you can make your own bread, which I think a lot of people are doing, and then you can store it in the freezer. Another thing you can do, which, boy, you can find that with all different fruits, is to root out the bad ones. So it could be apples, grapes, or berries. You want to go through your fruit and take out the moldy, rotten ones, because if they're sitting on the other fruits, then it's going to turn them bad too. So just pull out the ones that are all icky, and then you can have a nice fresh batch of strawberries or other berries that you might like. Be good to your cheese. Now, your cheese can last longer by changing the wrapping regularly. I had no idea. I love that. And try not to touch the cheese with your hands, because I guess your hands can make, have lots of oils in your hands, and that will make it go moldy faster. So that's great. You can probably put that in your own little a Ziploc, or you can do some other stuff. And then you can also store your fruit in the refrigerator. And I've been storing my avocados in the refrigerator as well, because of the warmer temperatures. Boy, those things seem to go bad quickly. So, fruits such as apples and oranges go bad faster at room temperature. So make sure you keep those in the refrigerator. And I like the way they have these all separated out. I wish my fridge had that much room in it. Then another thing is to keep your lettuce washed and in a paper towel. So that'll keep your leafy greens much longer and crisper. So there you go. There's some helpful hints on your groceries to make them last a little bit longer. And when we come back from a quick break, we are going to tell you about some other things that are going on today and the next couple of days. We'll be right back.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
As Orange County's highest-ranked hospital, Hoag is the place to turn to for timely information, reassurance, and care in these uncertain times. Our dedicated physicians, nurses, and staff stand ready to safely deliver world-class care, just as we have for nearly 70 years. This is what we do. We are here for you, and we will overcome this together. To access Hoag for all of your healthcare needs, visit hoag.org/trust.
Hey, well, good afternoon and welcome to the McCrae Man Cave in my lockdown. While you are locked down at home and wondering where your golf game has gone, there's some little things that you can do just on an ongoing basis to try to remember what that golf swing was like. Stay limber and stay active. This is something that I saw the other day and practiced with it a little bit. Thought it actually made a lot of sense. It's called the broom drill. This is a broom. Guys, if you don't know what this is or where this is, shame on you. So go figure out where this is and put it to some other use, but also you can do this with it. What we try to do is we try to create a situation where we have the swing plane. The swing plane, I think you all know, is what the club wants to travel on so it can come back and through back to where the golf ball is in a square manner. So what we want to do is we want to set the broom up right up against the ball or something on the ground, not a golf ball, because you'll hit it through a window and get me in trouble. When you rotate your shoulders, you want to make sure that at that point right there, it's pointing right at your target. You rotate your shoulders some more, you notice that one end of the broom goes right through the ball. As you continue to turn, it remains on that angle. But as you start down, we don't do this. We don't do this. We do right back through the golf ball again. Keep turning your shoulders. Club comes from the inside back to square, and we sweep the ball toward the target. Looking at it from this standpoint, I create the shaft angle. I have the shaft angle still, and as I keep turning, I force it to sweep toward the target. So we don't do things like this to flip the hands over. We don't do things like this to keep the hands open. We drive it down and we sweep. Get that down, don't break anything, and stay active. Hope to see you soon.
Back. Now today, if you are watching our morning broadcast from 9 to 11 a.m. at the parking lot of the Lutheran Church of the Cross, they are having the drive-through food bank again. So you don't even have to get out of your car, you just drive in, and I think they just hand you a bag or a box of lots of different staples that you could certainly use if you are in need. Now that is at the parking lot of the Lutheran Church of the Cross, which is at 24231 El Toro Road, right down the street from our community center. Now, if you have any questions, you can always call them at 949-609-8574, and they would be happy to answer any questions for you. But I just wanted you to know that that is this morning only until 11 a.m., and then they'll have it again in 2 weeks, and we'll remind you when that time comes. Okay, also music today, we have a couple of fun ones. We've got classical and Latin. So at, well, gosh, it already started, 9 a.m. this morning. You can probably tune in. I'm sure it will last about an hour or so. You can go to Facebook, HERE Arts Center, and that'll be classical, and that's the New York Virtual Opera Fest. And then there's Latin this afternoon at 1 p.m., and that's from the Lincoln Center, and that is the lincolncenter.org. So there you go. Then we also have a concert for the day from the Pickathon. And the concert today is at 1 p.m. and you go to YouTube Pickathon, and today it's going to be Black Mountain. So that might be something fun to listen to. And then also, one other thing I wanted to just remind you of is the Saddleback Memorial Care delivery that they have that you can call in. It's $21, and that is on Mondays, Tuesdays, and Fridays. So this Friday, you could have it delivered. I would call today, and that is 452-3333 or 452-3032. And you can call that in for Friday. And again, I think they do ask you about some of the things that you might need, and if they have it available, they will go ahead and get that to you and they deliver it. So that's a nice way to go. All right, let's take one last look at our weather. It's looking beautiful, very warm today and really hot tomorrow. So it was definitely warm yesterday, and the humidity is quite high as well. So, you know, it's a little stuffy out there, but nonetheless, here's our temperatures. We're looking at some nice temperatures today. Like I said, tomorrow is going to be 93, 60. By Friday, we do have a lot cooler weather, 81, 60. And by the weekend, we're going to be 80 on Saturday and 77 on Sunday. So very pleasant out. We wanted to remind you that today at 6 p.m. without subtitles, we are going to do a replay of the Hunt for Red October. Now, I believe the other day it got a little cut off, so we are going to replay that starting at 6 p.m. So we wanted to remind you, again, that'll be at 6 p.m. and the Hunt for Red October. So have a great day in the village, stay healthy, and we'll see you again tomorrow at 9 a.m. or you can watch our rebroadcast today at 12:30 and 5. Bye-bye.
It's important for you to get your financial house in order. And so it breaks my heart sometimes when I see widows that come in with $100,000, $200,000 to their name, and yet their broker has lost $200,000 or $300,000 in the market when they shouldn't even have been in the market. The most satisfying part that I find in working with retirees is when they come in on their annual reviews and the market has had a bad turn, and we know that we can sit down and look at them and say, you haven't lost any money.
Communities are starting to feel the financial impact of COVID-19, but we want you to know that there is help. We have disability insurance for workers exposed to or ill with COVID-19, paid family leave for those caring for an ill or quarantined family member, and unemployment insurance for reduced hours or lost work. We're all in this together. For information on how to stay healthy and resources for you and your family, visit covid19.ca.gov.